Hello, Mr. Bear. My name is Trisha and I'm with Respiratory Care. So I'm here today to give you some medications to help with your breathing a little bit. The doctor sent me in and wants me to go over some medications with you that we're going to be doing. We're going to be starting 3 new medications that are going to target your lungs. So before we get started, can I get your name and date of birth, please? Very good. Okay, so have you ever done any type of breathing treatments before? Okay, and have you noticed any side effects with those before? Increased heart rate, tremors? Okay, so you know that they do come on a little bit and go away. Do you have any problems with them getting worse or anything? Okay, very good. All right, so first I'd like to get just a few vital signs from you. I'll take a listen to your lungs and get your heart rate. Take a big deep breath for me. Good. Good, a couple more big deep breaths. Very good. And I'll get your heart rate here. Good, and then we'll get your oxygen level here. Very good. So this first one we're going to do, kind of like your breathing treatment. If you stated you did the nebs at home, it's the same thing. It's a nebulizer treatment. This one is called Xopenex, and this is a form of albuterol that we're going to use. Lasts about anywhere from 5 to 8 hours time frame. So we're going to do this 4 times a day, so every 6 hours for this one, okay? So this one, like you know, just seal your mouth tight around the outside of this mouthpiece. And then we're going to take normal breathing, but take a couple deep breaths here and there to get that medication down in the lungs. Are we ready? Okay. Take a big deep breath for me. Very good. This takes about 10 minutes in total to complete. Okay, very good. Now have you take a big deep breath in and cough for me. Very good. Okay, so now I'm going to take a listen to your lungs and see how they're doing after that. Couple big deep breaths for me. Very good. Very good. Okay, so I'm going to get your pulse again here. Good. So this one was kind of short acting. This will target that bronchodilation airways. Your airways want to dilate, so we're going to relax those, the smooth muscle within the lungs. We're going to relax those and let you breathe a little easier. Makes it that shortness of breath a little bit less, and that wheezing subside or a little bit less. Make it easier for you. So we've completed that one. That one's the short-term one. The next one doctor would like you to have is what we call Spiriva. And that one is that the first one that we used, we're going to reverse that tightness in your chest. This one is going to prevent that from happening. So over time, this is going to build up in your system and prevent that from happening. So with this one, we have a neat little, what we call HandiHaler here. Got a package of capsules and medication. You do not take those by mouth. Those, we're going to open up this little piece on the bottom, put that little capsule inside, and then there's 2 pieces on the side, 2 little buttons, and you push them together and it'll pierce that capsule. So this is what we call a dry powder inhaler. So it's a powder within that capsule. So you pierce it, then we're going to take breath out to let all the air we can out of your lungs, and then we're going to open this mouthpiece here, seal your mouth around the edge, and then take a big deep breath in for me. Make sure you keep this inhaler upright because it's got that powder medication, so if you happen to tip it or drop it, it's going to mess with that medication. So, all right, so we've pushed the button to pierce that capsule in there. Take a breath out to get all the air out of your lungs for me. Big deep, we'll see that around your mouth. Big deep breath in for me. Hold it for 10 seconds. And I'm going to move it away and breathe out for me. We don't want to breathe near the mouth of this inhaler because it's a powder in there, and we'll reintroduce humidity and then it will not work correctly for us. So that's what we want to do with that one. So with this one, we are going to use this. We're going to inhale this once every day. So this is more long-acting 24-hour. This can cause a dry mouth or a cough sometimes, but if it gets to be too bothersome, be sure and report that. So the third thing we're going to use today is what we call QVAR, and this is a meter dose inhaler. So this one is going to target the inflammation. So you have your first 2. That very first one was immediate. It will reverse that tightness in your lower airways. The second one, that was a little bit longer acting. That one is going to prevent that tightness from happening, or as much as it can. This one is going to target the inflammation because your lungs are starting to be inflamed because of that bronchodilation back and forth. So we're going to use this to reduce that. So this is a metered dose inhaler, and what we'll do, we're going to connect it to a spacer. We'll push, take a big deep breath in for me, hold it for 10 seconds, and then breathe outside away from the inhaler again. All right, so with this one, take off that mouthpiece, put that in here. All right, so maybe take a big deep breath out, seal, big deep breath in, push it, hold it for 10 seconds, and breathe out away from the inhaler. Very good. So with this particular one, again, this is the longer acting, so we're going to do one puff of this twice a day. So morning and night is the only time we're going to use this. So, all right, very good. With this one, have you rinse your mouth out, because this one, build up over time can cause thrush or yeast infection in the mouth. So take a drink here, rinse it around your mouth, spit out for me. Very good. Okay, we're going to do that every time. The other thing, if we're not, for whatever reason, if we're not using this, or if we're not rinsing our mouth really well after it, then it can cause kind of a buildup, and you can get hoarse, can change your voice a little bit. So if that happens, just make sure you're rinsing your mouth, you're using this correctly, and if it still continues and it gets worse, be sure and let us know. So after all those, I'm going to take a listen to your lungs again and get some of those vital signs. Big deep breath in for me. Very good. Okay, very good. Get that pulse one more time. And that oxygen level. Okay, everything looks good. Do you have any questions at all for me today, Mr. Bear? Okay, so you will see me get in about 6 hours for that nebulizer treatment. Like I said, we'll do that every 6 hours, and then we'll do those other two. We will do that Spiriva. We're just going to do that every day in the morning, and then the other one, that Q-Var, we are going to do morning and night. So you'll do that one again tonight. So, all right, let us know if you need anything. Thank you.